You wake up, try to roll out of bed, and a sharp, blinding pain shoots up your lower back. Your immediate instinct is to look inside your body and find exactly what snapped. The standard assumption is that you need to go into a high-tech tube so a doctor can take a detailed picture, locate the exact coordinate of the damage, and fix it.
Agonizing pain with a structurally pristine spine, or a heavily degenerated spine with absolutely zero pain. Ordering an MRI just to be safe frequently backfires. Seeing random imperfections on a scan spikes patient anxiety and often delays the actual solution, getting the body moving again with physical therapy. To understand why this happens, we have to look over the doctor's shoulder and see how they translate those glowing screens into a diagnosis. Treating the MRI as a flawless pain detector creates a dangerous loop of over-testing. We need to completely reevaluate what these incredibly detailed images are actually showing us. This vintage illustration shows the entire human vertebral column, giving us a baseline map of how the spine is constructed. The mechanics rely on two main parts: the hard, rigid bones, called vertebrae, and the soft, spongy shock absorbers tucked between them, known as spinal discs. This diagram highlights how that bony column protects the body's superhighway, the nervous system, routing the delicate spinal cord all the way up through the medulla and into the brain. While a standard X-ray bounces radiation off solid bone, an MRI takes a different approach. It uses powerful magnetic fields to detect the water content inside those soft, spongy tissues. This animation shows exactly what that looks like. A young, highly hydrated disc glows bright blue and plump on a scan. Over time, as it naturally loses water, it appears compressed and dark. The machine is an exquisite tool for mapping tissue density, but it has absolutely no mechanism to measure or visualize the subjective experience of pain. This scan captures findings that terrify patients. When a doctor points to a squashed disc spilling out of its normal boundary, it generates scary terms like disc bulge or protrusion. You might also see annular tear, meaning the disc's outer layer has naturally frayed. This chart visualizes spinal degeneration increasing exponentially with age. By 50, a completely pain-free person has an 80% chance of disc degeneration and 60% for bulging discs. Remarkably, even in your 20s, 9 out of 10 healthy people already have bulging discs. Since these severe-looking structural anomalies are overwhelmingly present in completely pain-free populations, a doctor cannot look at a screen, point to a bulge, and declare it the definitive source of your backache. Those frightening medical terms, degeneration, tears, and protrusions, are rarely traumatic injuries. They are expected, harmless milestones of physical maturity. Think of the spine like an oak tree developing deep, complex furrows in its bark over time. Scans just show wrinkles on the inside. This doesn't mean MRIs are useless. They remain incredibly powerful medical tools, but their primary job is ruling out or planning treatments for a few highly specific conditions. Doctors rely on these scans when there are serious red flags, looking for evidence of cancer, spinal fractures, severe infections, or a critical nerve compression issue known as Cauda Equina Syndrome, but those dangerous conditions are extremely rare. They account for less than 1 in every 100 patients who show up at a clinic complaining of lower back pain. For the remaining 99% of us, the vast majority of back and radiating nerve pain naturally settles down and resolves on its own within 3 months. A scary MRI report is usually just a topographical map of a life well lived. True recovery comes from treating how your body actually moves and feels, instead of trying to fix the picture on the screen.